We're all here today because we really believe that a lot of the future of health among our membership, in our communities, and in the healthcare system depends upon behavior change. All right, so we're all here because we actually think in one way or another there's a magic pill coming, and it's not going to come from the drug companies, though there are many, many marvelous contributions that are going to come that way. It's not going to come from genomics, although there's a lot of foundational research being done that will transform healthcare. But I think the magic pill that we're interested in is this health behavior change. And you've already seen and are well familiar with the data that it affects health status, medical utilization costs, productivity, health disparities. But here's one twist I'd like to present to you. You've all been in the meetings where Kaiser Permanente is celebrated and praised for our accomplishments in quality. And we deserve a lot of credit for that. And I think the curves are widening between our ability to deliver quality and many of the other systems in the community. At the same time, when I think about almost all of our quality measures, at the end of the day, they rely on a behavior change made not by us, but by our members. And that is, it's our members who decide to get preventive services. It's our members who come in for pap smears and mammograms, who return the fit kits that we mail to them. It's our members who take the prescribed medications that actually wind up showing up in better health outcomes, quality indicators. And it's our members who are really making the decisions that drive cost and quality in terms of deciding to come in for a particular symptom, to self-treat, or to come in too late when it's more costly and difficult to manage. And it's our members in terms of overall health promotion, from self-management of chronic disease to exercise, diet, smoking, stress management, and so on. So the bottom line for me is while we congratulate ourselves, one of the things we ought to congratulate ourselves is having the most engaged, most educated members of a healthcare system. Patient behavior drives most of the outcomes, and I think our members and patients deserve some of the credit because most of the quality measures really depend on them. This is a wonderful report that came out from Ernst & Young, who are really business analysts. And they said changing behaviors represents the single biggest opportunity to improve health outcomes while bringing costs under control. And I think that's part of the belief that brings us together.